Hi, I'm Kayla Hawley, and this is my type 1 diabetes presentation. Epidemiology of type 1 diabetes. The prevalence in 2016 showed that 0.555%, which is 1.3 million U.S. adults, show that that's the commonness of type 1 diabetes. Distribution: 1.25 million Americans have been diagnosed with having type 1 diabetes, and it has been seen that it is more commonly developed in males rather than females, and this is mainly just because of the differences in the male body and the female body. It's just the insulin sensitivity in the male body that leads them to be more common of having type 1 diabetes. And so the age that type 1 diabetes becomes a greater risk is age 10, and again, this is in males, and it just persists all throughout their all throughout adulthood. And as far as race, Caucasians are seen to be more susceptible to type 1 diabetes, so Caucasians are just more likely to have the genes to be diagnosed with type 1 diabetes. And the mortality in 2017, it showed that 83,564 death certificates showed that diabetes was the underlying cause of that person's death. Pathophysiology of type 1 diabetes. So pathophysiology is known as functional changes that is associated with having a disorder. And so for type 1 diabetes, this known change is insulin resistance. And when a person is diagnosed with type 1 diabetes, it is because their body no longer produces insulin like it's supposed to. And insulin is produced once food is digested to maintain blood sugar levels and provide energy in the cells of the body. So type 1 diabetes is the insulin is what the change is. It's something that they have to adapt to provide themselves their own insulin because their body doesn't do it on its own. And so if not taken care of, it can really lead to serious health problems and even death. Signs and symptoms of type 1 diabetes. These are just a few out of others that I saw. Increased thirst, frequent urination, extreme hunger, fatigue and weakness, blurred vision. And something that I also read up on kind of goes with frequent urination. A kid who has suddenly started to wet their bed more than maybe kids do, or they never did before and they started to, that is another sign of that they could potentially be getting type 1 diabetes. And there's really only two major risk factors that come along with type 1 diabetes, and that is family history and age. Family history is a really big one, because if type 1 diabetes is within your family, then the chances of you getting it is just very likely. And there are times where you have siblings that have it, and then one sibling may not. It's very pick and choose kind of, but family history is really a big one. And age, the onset is very early age, like very early childhood. So those are just major risk factors. Some complications with having type 1 diabetes, they can be either short-term complications or long-term complications. And these complications occur when the person does not take care of their health properly, the way that they are supposed to once they have been diagnosed with diabetes. So some short-term complications that can happen can be hypoglycemia, which is low blood glucose levels. And then another short-term can be a diabetic ketoacidosis, and that can become more serious if there is lack of insulin. So it's very, very important for the person who has type 1 diabetes to really maintain their insulin levels when they're supposed to, because if not, it can really lead to damage. And so that can go into long-term complications, which include damage to the eyes, kidneys, and nerves. To the eyes, it can become loss of vision. I've also seen people where their eyes start to go cross-eyed, or they're not straight no more. They move. It's kind of weird, but that's what happens when you don't take care of your diabetes the way you're supposed to, especially having type 1. And dialysis or kidney transplant, if they're not taken care of, and then nerve being damaged, can lead to nerves to not work properly all through your body. You could have many different problems when it comes to nerves in your extremities and just anywhere. So these are just a couple short-term and long-term complications that come with someone that can happen if someone having type 1 diabetes does not take care of their diabetes the way they're supposed to with their insulin. As far as lifestyle interventions go, there isn't really anything someone can do to prevent the onset of type 1 diabetes because of the risk factors being family history and their age. You can't really control having type 1 diabetes or not, just because if it's in the line of your family history, then it's just that likelihood, it's just that chance, and it's just a matter of being born and being diagnosed or not. So there's nothing really you can do to prevent having type 1 diabetes. But with that being said, there is ways to sustain the severeness of the disease. Like I just previously mentioned, short-term, long-term complications, those can be avoided if the person lives healthy, exercises, and they take care of their glucose levels. So here are just a couple of barriers, which are insufficient time for exercise and no self-motivation for healthy living, doesn't take care of their health, and they just constantly choose poor health choices. So insufficient time for exercise can mean just not having the time to go to the gym and exercise, and not making the time to exercise at home or exercise when there may be a time. It could just be that you live a very busy life and it's just really hard to make a time for exercise. No self-motivation for healthy living. That's just if the person really does not care about their health or choosing healthy choices at all. That can be very dangerous, honestly, with having type 1 diabetes, because if you don't choose to live a healthy life and not take care of your health, then that can just put you in the hospital, honestly. It could just really, really harm you. And just making poor health choices, all of this can be, it's the individual, really, that's individual's choice on if they want to live healthy or not when it comes to having type 1 diabetes. So in conclusion, as far as living with type 1 diabetes, the chances, they come with having a family history of type 1 diabetes. If it's in your family, like I've mentioned in previous slides, then the likelihood is just higher for that person. And early onset of age. So you would know if you have type 1 diabetes at a young age. And if you don't have type 1 diabetes, typically by the age of 10 or so, then you should be fine without having type 1 diabetes for the rest of your life, because if you have it, you don't, there's no chance of getting it, when you're 20 years old. If that's the case, you'd get type 2. But as for type 1, you'd get it at an early age. So, and like I mentioned before, prevalence rates, they show that 1.3 million adults have this disease, and the onset is within childhood, and it's just a long-lasting disease. It's not something that can be got rid of. It's just something that can be treated and sustained. So There are short-term and long-term complications that come with type 1 diabetes, like I've mentioned. You know, long-term, it can be damage to the eyes to where you lose your vision if you don't take care of your diabetes. You know, it can be serious, very serious complications. And as far as barriers goes, they come with the individual themselves. If they don't take care of themselves, then they become their own barrier. So, but there are many ways for people to get help with type 1 diabetes, and many groups to help people to understand what it's like living with diabetes, and how to take care of themselves the way that they're supposed to, so that they can live the life they want to live without letting the diabetes restrict them from ever being what they dream to do, and just anything. And then, so that's the end of my presentation for type 1 diabetes. And these are some websites that I used to get some of my information. They're just all right here on this slide. Thank you.